Hello everyone. Today we are going to discuss about pain pathway, how the pain travels in our body. Okay, so let's overview the pain pathway. Basically, the pain pathway starts at the injury site. Whenever there is any injury or inflammation, the pain travels from that site to spinal cord. Then from spinal cord, the pain goes to brain. Now here, the pain sensation is processed. Okay, and the command is then again travel back to the injury site. So basically, the pain pathway have the two paths, that is ascending pathway and the descending pathway. So like injury site and the brain. So this is the ascending pathway and this one is the descending pathway. Okay, so this is just the overview of the pain pathway. Let's discuss it in detail, how exactly this pathway work and where it relay. So before knowing about the pain pathway, we should know the anatomy of spinal cord. It is very necessary that we should know the anatomy of spinal cord. Okay, so basically the spinal cord has two major components. One is white matter and the other one is the gray matter. Okay, so this is the spinal cord. Okay, we have here the white matter and the gray matter. Okay, so the shaded area which I am marking, it is gray matter. This one is gray matter and this one is white matter. Okay, so because of the gray matter, the white matter is divided into various columns. Like because of this gray matter here, the white matter is getting divided into various parts. Okay, so this is the called as the lateral column of white matter. This one will be called as anterior column of spinal cord. This one will be called as posterior column of spinal cord. Similarly, the gray matter is also divided into horns. This one is the anterior horn. Okay, and this one is the posterior horn. Okay, so this way the spinal cord is summarized. Now the other thing we should know about the pain pathway is the initiation of the pain signal. For example, this is the injury site, and at this injury site the pain signals are initiated. Okay, so what exactly happens here? So basically the chemical mediator, major chemical mediator in initiating the pain pathway is bradykinin. Okay, so this chemical, it will bind to the nerve endings. Okay, it will bind to the nerve endings and it will open the sodium channels. Okay, and this way depolarization, or in simple term, initiation of impulse will occur. So the basic component is the bradykinin, which attached to the nerve ending. Okay, and it leads to the initiation of impulse depolarization. Now if we go in a little bit more detail, what bradykinin do here? Bradykinin, there are basically other chemical mediator also along with the bradykinin, which include the potassium ions, hydrogen ions, okay, histamine, okay, and so on. But this is the major chemical mediator. These mediators, when they bind to the nerve endings, okay, they will open the channel. They will open the channel. In a way, if we go in more detail, it will the resting membrane potential of the nerve and the nerve fibers or nerve endings is generally minus 70, not 75, it is around 70. So 70 millivolt. This is the resting membrane potential, and like the bradykinin, what it will do, it will attach with the nerve ending and it will open the channel. Basically, you just imagine the nerve ending, like the nerve ending have two channels. Okay, let's say the nerve ending have two channels like this. Okay, this is the, you can mimic this small channel as a key. Okay, once you open this key, this large channel will get open. Okay, so bradykinin will attach with this channel, with this one channel, and it will open this small channel. Okay, so from this small channel, the little influx of sodium will occur. Okay, and that will change the resting membrane potential from minus 70 millivolt to minus 55 millivolt. This is called as a threshold potential. Okay, so it will change this potential from this value to this. So these values are in negative. So you can say that the potential is increased. Okay, because the values are in negative, so resting membrane potential get gradually increased. Okay, yeah. So when it reaches minus 55, this value, cutoff value, is called as a threshold potential. At this value, this large channel get open, sodium channel get open, and there is a large influx of sodium. Okay, so influx of sodium occurs from this sodium channel, and that will rise the resting membrane potential from, like already it was increased up to 55 millivolt. This large influx will lead up to, it will increase the potential up to 30 millivolt. Okay, in the peak form, the value will become 30 millivolt. So this is how the bradykinin will initiate the, you can say, depolarization. So now what will be the basic pathway now? The injury site, this will be the injury site. From this site, the pain signal will travel to the spinal cord. Okay, this is the spinal cord, this one is the spinal cord. Okay, so this pain signal will travel to the dorsal. We say this as a dorsal or posterior horn of gray matter. Dorsal horn of gray matter, or you can say the posterior horn of gray matter. Here this signals from A delta fiber and C fibers travel to the dorsal horn or the posterior horn of gray matter. From this, they they do the crossover. They travel to the opposite side of the spinal cord towards the white matter, okay, through anterior commissure. Now what is anterior commissure? This part is called as the anterior commissure, okay, anterior commissure. I am sorry for the spelling mistakes, but just remember this is the anterior commissure, and this part of white matter, it is the relay station. Like you can in a very layman language you can call it as a railway station or a major transportation hub. This is the spinothalamic tract junction, spinothalamic tract, okay. From here the pain sensation then travels toward thalamus. It travels toward the thalamus, VHP nucleus, it has a nucleus, it travels here, okay. So the basic in this pathway there are major junctions. So from injury site to spinal cord, it is first order neuron. This is the first junction. You can in simple language you can remember it as this is the first stop of railway station, spinal cord. Then thalamus is the second stop of railway station, and the pathway is called as the second order neuron. Now from thalamus it goes to the cortex region, okay. So this pathway it is called as the third order, and the area in the brain is called as it is called as the postcentral iris, okay. So finally the pain sensation reaches to the brain in this area. Here the pain signal is processed and the command is then travel back to the injury site via descending pathway. This is just the ascending pathway of the pain.